One of my favorite things about being a spine surgeon is that we have a lot of cool toys. You probably know this, but we implant a lot of different size screws and rods. So let me show you around of a few of the different types of implants that we put in people's backs. This is a rod that we use for scoliosis procedures, and it's bent in the curvature of the spine that will help realign the spine to its natural position. And here is a rod up against a normal spine so you can kind of see how that curvature makes sense. This is a pedicle screw that will go in someone's lower back or lumbar spine compared to a pedicle screw that we'll put in someone's neck. So you can see how much smaller that is. That's compared to a pedicle screw that we'll place through minimally invasive techniques that have an extended tower that allow us to put it in through really small incisions. And then when we're done, we can break off that tab at the end of the screw so it looks just like this when it's done. This is a screw that we'll use in sacroiliac joint fusions or fusions down in the lower part of our pelvis. And this is an example of a plate and screws that we use in cervical spine surgery, like in an ACDF, an anterior cervical discectomy and fusion. In terms of cages that we use in the disc space in certain types of surgeries, this is a cage that we use in cervical spine surgery or in the neck. And that's compared to a spacer that we use in an anterior lumbar surgery or in the lower back. So you can see how much different the sizing is when we're working in the lumbar versus the cervical. Here's an example of what a cage looks when we put it in through a trans-psoas approach or through the side of someone's spine. This is a T-lift cage or a cage that's placed in through the back part of someone's spine. So you can see the marked difference in how much of a footprint going lateral versus posterior will get you. And last but not least, this is an example of a corpectomy cage. So if someone breaks their entire vertebral body and we have to remove that, this is an example of a cage that will replace the vertebral body, will occupy that space in its vacancy. And that's just a small example of some of the really cool stuff that we get to do in spine surgery to get people out of pain and back to their normal life. Did I tell you that I love my job?